Eroxon is a topical gel that may be applied immediately before sexual intercourse. Studies show that 65% of men who used it achieved an erection within 10 minutes and maintained it long enough to have sex. Eroxon contains a combination of volatile solvent, which when applied to the head of the penis evaporate of it rapidly, stimulating nerve sensors located in the glans penis for an initial cooling effect, then a recovery warming effect. This temperature-tight pressure effect results in the natural release of nitric oxide, which activates the relaxation of the corporal cavernousal smooth muscle tissue inside the penis, causing increased blood flow and the hardening and expansion of the penis into an erection. Indications. Eroxon is only used by men who have problems with erectile dysfunction. It is not recommended for those who do not have problems with erectile dysfunction. How to use. Eroxon gel is applied in single-dose tubes. One single-dose 0.3 ml tube of Eroxon gel is intended for a single intercourse attempt. The gel is massaged onto the glans of the penis for 15 seconds just prior to intercourse. Contraindications. Eroxon is not suitable for men who are allergic to any of the ingredients, have been advised by a doctor to avoid sexual activity, have any disease or deformity of the penis, have irritation, redness or soreness of the penis, or where the skin appears damaged or broken. Precautions. Alternatives of Eroxon include popular erectile dysfunction treatments such as Viagra, sildenafil, and Cialis, tadalafil. The popular generic versions of the treatment such as sildenafil are also available at a more cost-effective price. The results of a study concluded that approximately 3% of men reported headaches, while 1% of men and 0.4% of their female partners reported a localized burning sensation.